Today we're going to bring you behind the scenes into the radiologist reading room to show you what we do on a daily basis. Come on. This is a younger patient who came in with shortness of breath. And the question is, do they have pneumonia? So if you look carefully here again, you can see that this is a frontal view looking at the chest from the front. And if you look, most of the area is black because that's what indicates the lungs or air on x-ray. And if you look carefully, and it's always important to know what's normal before you know what is abnormal, this part of the lung is normal. It's very black where the air is, and you can see other structures very well, the diaphragm, the cardiac border on this side. But on this other side, you can see it's blurry, if you will. It's a little more white than it is black, and that indicates the presence of a right lower lobe pneumonia. So in this case, patient came in, young patient, short of breath. We've diagnosed pneumonia for them, and they can go back to their doctor and be treated with antibiotics and ultimately follow it up to make sure they get better. This is another example. Similar scenario. Again, you can see the lungs are very black. That's normal. That indicates air. And then this area here is white, if you will. That indicates the presence of something in the lung. And it could be anything, really. It could be malignancy. It could be hemorrhage. But in this case, we think it's likely pneumonia. But of course, they'll treat them with antibiotics and follow it up and make sure that it resolves and it's not, God forbid, an underlying cancer.